As daily temperatures drop and flu season begins at this time of year, it's time to be particularly cautious of infections and illnesses, with prevention, of course, being the best medicine. We're hearing the word immunity more often than not these days, and ways to maintain and boost it to keep ourselves strong against all sorts of conditions that catch us when we're tired, overworked or slightly poorly. For insights on how we can guard ourselves during the colder months, we turn to Dr. David KWAK, Assistant Professor of the International Clinic at Hyang University Hospital, and Dr. Bruce Wiley, Professor of Health Policy and Management at City University of New York School of Public Health. Lovely to see you both again. Thank you for joining us. And, well, to begin with you, Dr. KWAK. First of all, we're hearing a lot about this combination of flu and COVID, and how bad is flu and COVID-19 going to be this winter?
Well, it's hard for me to make a rough judgment, not basing on any scientific evidence, but I do foresee that personally, that we're not going to have as much of a problem compared to other countries around the world in regards to COVID-19 slightly yet, because it is rather approximate in the time due from our last huge waves through the pandemic, and the majority of our population actually were naturally infected through that phase, possibly receiving a very short-term immunity as well as the long-term. So I think we might be able to easily slide through this winter in regards to COVID-19. But also looking at the situations Australia and New Zealand went through in regards to influenza, as opposed to past 5 years or so, they had a 2 months premature epidemic occurring in regards to influenza in their own countries. Thankfully, it was not so dire that it became more than in size than before. But I do think that we still have to be careful in regards to influenza, especially having not gone through completely with COVID-19 yet. So I know this is a mixture of information that I might be confusing some people, but in any ways, even if we foresee that we might be having rather easier times in regards to COVID-19 and possibly with influenza as well, it's still much better to be ready and vaccinated against both of the viral components. So I do recommend everyone who are listening or watching us currently that they be vaccinated against COVID-19 as well as influenza, preparing ourselves for the winter time.
Right. And Dr. Lee, well, these days we keep hearing the importance of keeping our immune system strong. And, we've got these YouTube lifestyle gurus talking about this as well, like nagging us to sleep, hydrate, and eat lots of kale and avocados. I mean, I like avocados. I know you like avocados, Dr. Lee. But anyway, what does it really mean to have strong or weak immunity?
Yeah, well, nothing wrong with eating avocados. So, yeah, in general, it's important to maintain a healthy lifestyle. That means get enough sleep, because when you are sleep deprived, potentially your immune system might be a little weaker. You want to continue to eat healthily. You want to try to avoid bad habits, unhealthy habits like smoking and things like that, which may potentially suppress your immune system or affect the way your respiratory tract can potentially clear particles and other things like that. And stay hydrated. So yeah, basically maintain a healthy lifestyle. And of course, you also want to get the proper vaccines to generate immunity against those viruses.
And Dr. Lee, well, we're hearing about how stress can actually lower our immunity, but is this something of a pseudoscience, or can it actually really affect our immune systems? Yeah,
studies have shown that when people are under severe stress, they are more likely to have different types of respiratory illnesses. They are more likely to have different types of health conditions like that. So now, of course, it's hard to draw the line, like how much stress is too much stress. So certainly severe stress is not good. But in general, you want to try to manage your stress as much as possible. Of course, there's some stress that's unavoidable, and also some stress in life is good because it helps encourage you to do things and helps keep life exciting. So the key is balance.
Right, and another question for you, Dr. Lee. Now, other than COVID-19 and the flu, what other viruses or conditions can actually catch us off guard when we're feeling a little under the weather?
Yeah, so this is something important to remember. One of the things that's happened over the past couple years is because of the COVID-19 precautions, we've actually seen lower incidences of other types of respiratory viruses. And that's occurred in many different countries because when you're doing things like wearing face masks, distancing, you're also preventing the spread of other types of respiratory viruses. So the concern is when some of those precautions are being relaxed, we may see upswings in things like adenovirus. Of course, also already mentioned the flu virus, but parainfluenza, parvovirus, respiratory syncytial viruses. Those are just some of the different types of respiratory viruses you have to be aware of. And also there's the chance of being co-infected with virus. On top of that, you have some of these viral infections, for instance, you have the flu or you have COVID-19, that put you at greater risk for other types of microbes like bacterial infection. So sometimes what happens is when you get the flu or if you get something like COVID-19, what actually can do a lot of damage is a secondary bacterial infection. Because you have growth of bacteria because your defenses are weaker and you're busy fighting the virus.
Right, and well, Dr. KWAK, now I've personally had shingles very recently, and well, I was actually told that this was due to low immunity. Now, but then I heard a lot of, there's a growing number of shingles cases, and it's been quite prevalent since the pandemic began as well. So why has there been such a large increase in the number of shingles cases, particularly among young people here in South Korea?
Well, in order to talk about that, we need to first understand how shingles work. Shingles is not a case where a direct infection usually causes these painful symptoms, but rather our understanding is that shingles actually happen from an infection that happened very, very long time ago. For certain adults, it can actually be dormant for 20, 30 years before becoming symptomatic, and it usually happens to a virus lineage called herpes virus. And herpes virus, as we know, is a very common virus that spreads through human contact and easily through kissing and anything else, droplets and whatnot. So when shingles happen, usually a person is going through, as you said, lower immunity, but there's no clear definition of low immunity. What we call low immunity in cases where people were tired more than usual, or they're going through extreme stress, that might bring the immunity level down for the person. So the virus, having been dormant within the nervous system, starts to sprout out on the skin and causing all this pain, having evaded the immunity that were actually keeping the virus dormant. So that's where this immunity comes from. I believe the increase in numbers we're seeing, especially among young people to go through shingles, is primarily due to those younger generation spending more time indoors and not getting enough exercises, not getting enough sunlight outside, and also possibly having a poorer diet. So I think there could be multiples of factors, but more so, I think rather than blaming on the virus itself, I think we have to look back on ourselves, what kind of a living condition we're carrying, especially among the younger generation.
Right, and well, because I heard that shingles actually derives from the same virus as chickenpox, I was cursing and bemoaning chickens for about 2 weeks before finding out that it's not actually from chickens. But Dr. KWAK, then what is the best way to prevent shingles and maybe alleviate some of the symptoms that come with it if we inevitably happen to catch it?
Well, there's actually a formal guideline for people younger than 55 years old who are immunocompromised, and also for people who are above 55 years old to receive preventative vaccination against herpes zoster virus. But other than those people, for general public like us, I think I would strongly recommend having a regular lifestyle, segmented lifestyle, that we have exercise for a certain amount every day, and we keep a very good balanced diet. We spend enough time exposing ourselves to sunlight for at least a certain amount every day. If we keep a very regular lifestyle, it builds up immunity gradually to a level that cannot be brought down that easily. So I would strongly recommend regular exercise and balanced diet.
And Dr. Kwak, in South Korea, it seems something of a trend, really. People going to the clinic and getting those vitamin D or whatever IV shots, and thinking that this really does boost their immune systems. To what extent do these actually work, and can they help keep us strong throughout the winter?
Well, there are actually a mixture of studies that prove either for or against the use of these vitamin pills and vitamin injections. I don't personally recommend receiving vitamin injections in preparation for anything. Vitamin injections should be required for people who are completely lacking it in their circulation. But as I said, in a balanced diet, we get plenty of vitamin, anything from A to E. So I don't think there's worry that we need extra booster injections of vitamins in any sense if we keep our lifestyle regular.
And Dr. Lee, well, due to globalization, we here in South Korea can get a lot of health supplements shipped from America. And I've been getting a lot of emails recently with those flashy marketing content. And well, to what extent, excuse me, should we take these different kinds of health supplements? I mean, there are quite a few out there, aren't there? Like omega-3, vitamin D, vitamin C, iron, magnesium. I mean, to what extent should we take this huge range of health supplements?
Yeah, one has to be very careful because the supplement industry, certainly in the United States, is not very well regulated. So there can be a lot of claims out there about these different supplements, but many of them are not backed by scientific evidence. In general, it's always better to get vitamins and other types of nutrients through natural food because there has been studies that have shown that when people are taking vitamin supplements, even if they're legitimate supplements that don't have extra additives or extra unknown ingredients, many times those vitamins aren't absorbed very well, and they basically body. So in general, it's better to eat the right nutritious food that have the right type of nutrients. In some cases, for instance, vitamin D is an exception. It can be difficult enough vitamin D in your diet, have the sunlight. So for some folks, we recommend vitamin supplements, but that's only if you feel that you are vitamin D deficient. But with a lot of the other supplements, it's a lot better.
We seem to be having a bit of an audio connection issue there, but well, before we go, Dr. Kwak, we often see on social media, very a wide range of ways to keep our immune system strong. I mean, there's hydrating to eating kimchi, even to doing daily runs, and of course taking supplements, as we just said. But what's your personal advice in order to really keep ourselves strong throughout the colder months?
Well, as I was saying, as a physician, I usually recommend having at least 20 minutes of aerobic exercise every day for at least 5 days a week. So that means an exercise that requires to run out of breath. It not only requires you to run a certain distance or walk up a certain distance, but the more important part is that you actually start to run out of breath for at least 20 minutes every day. So that'll probably put you at either bicycling or running or swimming and etc. If you keep a certain level of exercise, especially including of aerobic exercise every day, I think it'll be able to keep your immunity level at a very high level. But as Dr. Lee was also saying, keeping a very good balanced diet is also very important.
I see. And Dr. Lee, what would be your advice on this? How should we really take care of ourselves and, well, try to keep ourselves from getting sick?
Yeah, so I think it's a combination of certainly exercise, physical activity is important, eating a balanced diet, and there might have been audio problems, but I think it's a whole lot better to get nutrients through natural diet rather than through supplements. Supplements, many times you don't even know what's in the supplement, and many times supplements just pass through your body. So that, and of course, adequate rest, good sleep, and manage your stress. I think those things are very important. And part of managing stress is social connection. So you want to kind of maintain good social connections, keep in touch with friends, have a good support network.
Right, really making sure that both our mental and physical health are, at optimal levels. And well, this is where we're going to wrap up today, but thank you so much for joining us this Friday here in South Korea. That was Dr. David KWAK, Assistant Professor of International Clinic at Hyang University, and Dr. Bruce Wiley, Professor of Health Policy and Management at City University of New York School of Public Health. Thank you both so much for your time.
Thank you for having me.
Thank you also to our global viewers for joining us here on Global Insight. We're going to be back Monday in Korea time, so do join us then for more experts' insights on issues making headlines around the world. Have a lovely, wonderful weekend wherever you are. Goodbye.